and I chose to do my etiology project on syphilis. Syphilis is a sexually transmitted disease or infection. It's not known exactly when the first case of syphilis was recorded, but there are records that date all the way back to the late 14th, early 15th century. It's rumored that the seamen aboard the Mayflower with Christopher Columbus are responsible for the introduction of syphilis to America. That's just a rumor. We don't really know if that's true. Although it's unknown exactly when and where it started, we do know now what causes it and how to treat it. The binomial name for syphilis is Treponema pallidum. Here's a picture of the bacteria under a microscope. As you can see, it has a slender spiral shape that almost resembles ramen noodles, except I'm sure a little less appetizing. Treponema pallidum contains endoflagella that have protein filaments that give the spirochete its shape and help it move around. Treponema pallidum is a part of the Eubacteria kingdom. Its class is the spirochetes, species is the T. pallidum, and subspecies is pallidum. Syphilis has two modes of transmission. The first, most common one, is through direct contact with a lesion during sexual or intimate contact. This is known as acquired syphilis. The other is known as congenital syphilis, where infected pregnant mothers transmit the infection to their fetus. And then a quick disclaimer at the bottom. The bacteria causing syphilis dies very quickly outside the body. Syphilis cannot be contracted from toilet seats, bus seats, bathtubs, hot tubs, doorknobs, eating utensils, cups, clothing, or swimming pools. 4 stages of syphilis: primary, secondary, latent, and tertiary. You'll often see the latent stage split into 2 categories, early latent and late latent. The primary stage, usually between 10 and 90 days after infection, is when initial symptoms appear in the form of sores or lesions found on the genitals or in the mouth. The secondary stage, usually occurring 1 to 3 months after infection, may reveal more symptoms like rash, fever, weight loss, or muscle and joint pain. The early latent stage will make way for improvement or resolve of symptoms, even though infection still remains in the body. The late latent stage will have no symptoms at all. This stage can last for many years, and the time of infection is really unknown. The tertiary stage is usually the last and most harmful stage, where many organs in the body can be affected. Tertiary syphilis is not as common as the other stages. Tertiary syphilis can occur many years after initial infection, wreaking havoc on the neurological, ocular, and cardiovascular systems. Neurosyphilis affects the brain and the spinal cord. Ocular syphilis affects the eyes, usually the retina and the uvea. Cardiovascular syphilis commonly affects the aorta and the coronary artery. Complications of these conditions caused by tertiary syphilis can result in death. And over here you can see examples of cardiovascular syphilis and ocular syphilis. Here are more symptoms associated with syphilis. You will notice most of these symptoms are generic symptoms like headache, fatigue, weight loss, and muscle pain, which is why syphilis is commonly referred to as the great imitator. Most of the primary and secondary stage symptoms mimic symptoms of other things like a common cold, a virus, or even things like Lyme disease or COVID-19. One of the main reasons syphilis goes untreated is because the symptoms do eventually resolve. They're so generic, and the infected person does not have any lingering concerns. If you are sexually active, it's important to be screened or tested regularly for syphilis. There are many different tests and methods, including observation of the motility of the spirochete on a wet prep under a dark field microscope. This is usually done with a fresh sample of fluids from an active lesion. Antibody testing, including the VDRL and RPR rapid plasma reagent screening test, measure amounts of antibodies produced by the syphilis bacteria in the body. These tests, if positive, do require a confirmatory test, such as the TPPA or the Spirotec syphilis test. The Spirotec syphilis test is recommended by the CDC due to its high sensitivity. There are also POC testing, or point of care test, that can be done rapidly. Often you'll see that these tests will be combined with the HIV virus. Although there's no vaccine for syphilis, penicillin remains a very effective form of treatment. For people who have an allergy to penicillin, doxycycline, tetracycline, and azithromycin have all been approved and recommended for treatment. Although there has recently been instances of azithromycin resistance. It's important to take medication properly to ensure infection has cleared. It's equally important to make sure your partner has been tested and treated to prevent reinfection. Although condoms are not 100% foolproof in the way that they help prevent infections, it's still very important to practice safe sex. Syphilis infections are mandatory for reporting in all states. Reports should be made to the local health department. Here are some not so fun facts. Contrary to popular belief, syphilis is still around and thriving. Infections are still very prominent and have even seen a surge of cases per the CDC. Over 130,000 cases were reported in 2020. That's reported cases. Those are people who know that they have infection. Imagine how many people still don't. Syphilis infections also greatly increase the odds of HIV infections because having sores or lesions caused by syphilis allow the virus causing HIV to enter the body more easily. And lastly, even though infection is spread through sexual contact, no penetration needs to occur for infection to be transmitted from person to person. Coming into contact with an active open lesion does put you at risk for syphilis infection. So that's all that I have to tell you about syphilis. Here are some resources that I use to gather information. The